Hi everyone, welcome to my second video on mobility. This one is on hip mobility, and I'm Peter Clark with Custom Fit Personal Training Studio. We're going to work on the thigh here, and I'm narrating this video, not talking in real time. So just showing you guys the muscles that you want to roll. This is your tensor fascia latae, your hip flexor group, and it's important to make sure that you roll out first, or apply the myofascial release technique before you stretch the muscle. So there's three main rolls and three stretches for the hips. I keep it very simple. This is the technique for rolling out your hip flexor, the front of the thigh. You want to be on one elbow, and you want to keep the roller moving up and down your thigh on the outer part of the front of the thigh. That's really where most of the tension is going to be for most of you. You always want to roll for about a minute or two per side, and this also strengthens your shoulders and your abdominals because you're kind of in a planking position. So I'm just showing you guys here the vastus lateralis, that's your outer thigh, and there's a lot of tension on there. People who stand a lot or sitting will shorten that muscle as well. So you want to roll it out, you want to relax the leg that you're rolling, and just search for where the tightness is. Now, I'm just switching up my technique a bit. I'm moving the roller up my thigh, and now we're performing myofascial release on the tensor fascia latae, or the TFL muscle. And this muscle gets really tight on office workers, so if you sit down a lot for your job, or if you're in construction operating equipment or a truck driver, this muscle can cause a lot of lower back pain actually. So it's a good idea to get on there. It's more in the crease of the hip. You can see what I'm doing. I'm lifting the bottom leg off the ground, and that puts the TFL into a pre-stretch. And note the position of my hand as well. That's quite a comfortable position to hold, but you want to roll on that for about a minute or two. And again, for the rolling, try to find the tenderest spot and just move very slowly over it and give it a minute or two to release. Now I'm moving this bench into position for the hip flexor stretch. This is called the couch stretch, and I invented this stretch utilizing the bench to stretch out the front of your thigh, that hip flexor group. So after you've performed your myofascial release, you can perform this stretch, and the target, if you have healthy hip flexors, is to make your body the same angle as the back of the bench. So if you have a couch, you just want to lean back as far as you can, and it's important to squeeze your glute. So you need to squeeze your butt cheek and lean back, because I make it look easy, but you can see the angle of my lower back. I'm not arching my back. I'm actually crunching my abdominals down and performing more of a hip thrust action. So you should feel that in the front of your thigh. And if it's too tight, if it's too much, you can always lower the back of the bench down. And this gives you, for people who are really tight, a good stretch without affecting your back. So that's the first area out of the three areas of the hip that you need to check your mobility on and maintain with those two techniques. The second area is, your glutes, basically. So we have the front of the thigh, and now we're going to apply a myofascial release to the glutes. So I like to use a dense medicine ball, and it's pretty tight there. You want to relax your bottom leg. You're going to sit on the ball right where your femur inserts into the hip socket, into your pelvis, and you want to move very slowly. The more dense the ball, the deeper it digs in. And you want to search for where you get a bit of sensitivity. If pain shoots down your leg, you may have a syndrome called a piriformis syndrome, which is a very tight piriformis muscle in your deep glute, caused from too much sitting. So you want to go easy on this, or use a softer medicine ball and gradually progress to a harder medicine ball, and that will loosen up your glutes. So I'm just showing the area where you want to roll. So that's an easy way to apply myofascial release to the glute. And now I'm going to grab a bench and show you the stretch I invented here. And for this stretch, You're going to stretch one leg at a time, and again, it's for your glutes. You want to place your foot sideways on the bench first, then plant your hands, and then slowly drop onto your knee. Now, I'm 6'1", so for you shorter people, 5 foot, 5'6", you'll need to put a pad under your knee to prop yourself up. And your glutes are perfectly flexible if you can touch your elbows to the bench, like what I'm doing. If you can't do that, no worries. Just hold the stretch for 2 minutes on each side until you can touch your elbows down. So I like measurements. I like tangible things. I perform these stretches with all my clients to make sure that their hips are in tip-top shape. This way they can achieve the proper anatomical postures for things like squats, hip hinging, deadlifts, push-ups, all those exercises. And here I'm just demonstrating, if you are tighter, if you can't even get into this position, elevating the knee like that will help. And if you're doing this, again, you can do this facing a couch. You don't need an exercise bench. You can do it at home as well. And that is the glute. And now the third and final area of the hip that you need to worry about is the inner thigh, or the adductor group, and the hamstring. So you can set a roller on a bench like I'm doing and just showing you where I'm rolling. And this area again gets tight from just sitting too much. And people with something called butt wink, when you squat, if your butt tucks under, you have a hard time getting depth. This is the roll you want to perform. Also, if you've ever pulled a hamstring when you're sprinting or running, then this area will be tight, and you could use some help on the roller for this. And if you can't touch your toes, that's another indication that you need to perform this roll. Try to keep your leg up and straight as much as possible, and you're going to keep the roller on the upper hamstring, more where it inserts into the pelvis underneath your glute. So think the area just below your bum cheek crease. And it does help if you're on a bench. You can do this on the floor as well, but you have to be very flexible to be able to do it properly, and strong as well. So this technique, I find, works the best. Again, 1 to 2 minutes. If you find that it's not tight, you don't really feel anything, then you don't have to worry about rolling it. The stretch here I'm going to show you is what I call the V stretch. You're going to put your legs into a 90-degree angle, spread wide like that. And the idea is to make your elbows touch the floor. If you can do that, congratulations, you have flexible adductors, and you should be able to squat fully to depth with no problems. And your hamstrings and adductors are in good shape. They're nice and have good length. You can also switch back and forth like I'm doing here to stretch out a bit of the lower back and lats. So, and there's that perfect squat. Hope you guys enjoyed the video, and let me know what you think.